Hi everyone, it's Rose, and today I want to talk about something very serious and kind of anxiety-ridden. I want to talk about Obamacare, also known as the Affordable Care Act. Obamacare required insurance companies funded by the government that were public to not discriminate against people for pre-existing conditions. Thank you, Obama. You literally saved my life. When I wanted to start hormones, I was under my parents' insurance, which Obamacare allows children or just young adults through the age of 26 to stay on their parents' plan. And while that's a really great thing for some people, it didn't work out for me. Osmond wants to come and comfort me. Come here. In a 2010 national survey, more than 19% of trans people said that they were denied coverage because of their pre-existing condition of being transgender. Even if they were just trying to go for a simple checkup, or maybe they had strep throat, needed some antibiotics, simple things like that, they could be denied coverage just because they were transgender. In that same survey, 28% of trans people said that they were harassed or bullied in a hospital setting. My parents were under an insurance plan that denied coverage for any trans-related healthcare. So they were discriminating against people with pre-existing condition of being trans. And so I had to do a lot of research and get on my own insurance plan. I am currently on Washington State's version of Obamacare. They call it like Washington Apple Health, I think is what it's called. So in my situation, I probably wouldn't be able to afford all my hormones. I take 200 milligrams of spironolactone twice a day, and I inject like a quarter of a milliliter of estradiol into my thigh once every 10 days. In September, I found out there was a national shortage for estrogen, and for injectable estrogen. Bamby Salcedo did an interview with, I forget which article, I'll link it down below, but it was posted in like a lot of different news sources, and she brought it to my attention, and she basically explained that Par Pharmaceuticals, the main like distributing company for injectable estrogen, announced that there's a shortage in manufacturing. The FDA has only approved a limited type of estrogen that is safe for people to inject. So it's kind of a bureaucratic process of the FDA needs to approve more sources, so then we can have more manufacturing and then more distribution, so then there won't be a national shortage. Hormones are life-saving. I don't know how many people understand how true that statement is for me. Like, right before I started hormones, I was in such a depression. I hated myself. I struggled with thoughts of wanting to self-harm again. I just felt so uncomfortable, and so I didn't feel at peace in my body, if that makes sense. Transgender people already have a 1 in 12 chance of being murdered. For trans women of color, there's a 1 in 8 chance. And, you know, hormones are life-saving because not only do, like, they make me feel more at peace in my body, but they also make me blend into society easier. I look so much more feminine now. I don't get clocked very often. I can walk down the street and people will just ignore me because they assume I'm just another woman walking down the street. Before starting hormones, or like before like they started to really take effect in my body, I used to get harassed all the time on the street. Someone would start shouting, "That's a man," like, "That's a man in a dress," or like they would be like, "That's a tranny," like, "You're so ugly," or, you know, just get attacked horribly in public. And now that I'm on hormones, I blend in more, I look more feminine, and that doesn't happen, and probably saved my life. I'm not one of those 1 in 12 women. But now with Republicans trying to repeal the Affordable Care Act, I just don't see any of this being solved. If it weren't for Obamacare, then I wouldn't have been able to start hormones, I wouldn't be able to afford hormones. Obamacare also helps millions of other people. And this is just so frustrating because after the Senate voted to try to repeal Obamacare, this could take away my right to healthcare. Maybe the House and maybe Congress and maybe other departments will help prevent it from being repealed, or maybe try something better, but I don't have much faith in that happening, so I'm just really worried, and I just wanted to kind of talk about what I'm kind of scared of. So what can we do about it? Everyone has a voice. One of the most important things you can do to help people out is just start talking and not be silent. I marched in the Women's March here in Washington State with over 170,000 people, and it was such an amazing day just to feel a part of a community and to just start screaming and yelling, get some of my anger out. It was really, really good for my mental health to just be a part of something greater than myself and something so large and powerful. I felt like I was really listened to, seeing all the coverage afterward. On MSNBC, I even saw them talking about transgender rights. They said the word intersectionality. They even explained gaslighting and said how wrong it is for the White House to be gaslighting the American people. They also used the term bisexual, which was amazing to see on the news. You don't hear those words on the news very often, but the Women's March really brought attention to a lot of issues that we need to focus on that a lot of people aren't. If you can't march, if you can't speak, there are a million other things you can do. Just try to utilize your tools to like make a difference. I have a degree in film and I have film equipment, so I can make videos and I can talk about my worries, and maybe someone will hear me and be like, oh, maybe we shouldn't repeal Obamacare. What can I do? Maybe call your senators, send an email to your representatives. I don't know what you do, but use your skills. Don't be silent. Let's resist this administration that's trying to take away our rights and possibly, take away healthcare from a lot of people that really need it. My life was saved by Obamacare, and I really don't want to take away other people's life sources, so let's see what happens. I'm really anxious about this. I've spent hours on end sobbing and crying, freaking out, hugging people, staying close to my friends, and I'm just trying to get through each day, one day at a time. Thank you so much for watching this kind of somber video. Don't forget to like, comment, subscribe if you like. Follow me on other social media platforms too. Thank you for watching. Resist.